This?
We are the wonderful world.
We are. That's true. Always, always. When you come in, I never know what you're going to talk about, but I am so glad you brought your book.
Yes. We're going to talk about my book.
Yeah. Did people really know about your book?
You know why?
Why?
Because I was listening to, in the media, there's so much stuff on the heart. People are so scared about the heart and heart attack and enlarged heart, and we spoke about congestive heart failure and also about the lung cancer, because of the high prevalence of condition that from childhood we can suffer regarding the lungs and your heart. There's a lot of talk in the media about those organs. And when I put this book together, I was so amazed to the fact that there are not so much literature out there that educate the layperson on what the kidneys are supposed to be doing.
And why is that?
That was one of my questions in my research. Why? Why not? I mean, am I crazy, or am I just looking at something that nobody else want to look at? It's going to be a waste of my time. And being a national speaker on kidney disease, I have so much material that I have enough to easily put a book together. And I asked myself, why is that? Why there's not enough material out there? And as I started putting the book together, I didn't have the answer to why. But when I started putting the book together, I noticed that so many people die from kidney disease than those that go to dialysis.
Wait. What do you mean? They die?
Most people die with the disease. Once their kidneys start damaging, they start becoming more and more sluggish. They die before they even end up in dialysis. So a small percentage, in other words, small percentage of people with kidney disease end up in dialysis.
That's very interesting.
And that's in a developed world like here. In a third world country, the number is staggering. The number of people that just die with kidney disease. People that here in this country with salvage, with, let's say, stage 1 or 2. Here we go to stage 3, and that's when they die here. But in third world country, they die with, earlier disease.
Well, let's move back. Let's say I'm one of your patients. No, I'm not one of your patients. If I were, you would have known I had kidney disease. Let's say I'm just a person out there. How do I know I had kidney disease?
That's a great question. That's an excellent question. First of all, people should know the kidneys are is in your abdomen, and they are located in your back, in your abdomen. So that's why sometimes people have back problem, and they go and get painkiller for back problem, and their back problem can be coming from kidney damage, not from muscle strength or spine or anything like that. The kidney sit right next to the spinal cord. One is right behind the liver on the right side, and the other one is behind the spleen. So even the spleen is in front of the kidneys. So let's say when you have a car accident, sometimes you get rupture of the spleen, right? Because the spleen is an anterior, not a posterior organ. So the kidney are behind, and a lot of times we get back pain, and we think it might be muscle related, or we're getting a little bit of arthritis. And if they do an X-ray of the back, most of us are going to have some form of arthritis in the back. So, your back problem is because you have arthritis, and we stop there. We stop investigating. And we buy that, and then we say, okay, let me start taking non-steroidal anti-inflammatory like Advair and Aleve and Tylenol, aspirin, not knowing that this non-steroidal will enhance the process of damaging your kidneys. So a lot of people end up in the hospital with what we call acute tubular necrosis. Acute means that it happens suddenly, tubular is one of the portion of the kidney that function in filtration. And necrosis means dead tissue. Right? Like when you get necrosis of the skin, it's dead tissue on the skin that you have to get rid of that. So an acute process is telling you that this thing didn't take 6 months to occur. It happened in 1 to 5 days of abusing certain medications. Sometimes when we have kidney damage, we start seeing the color of the urine change on us. We might not get burning sensation, but just the color change. And we see the change in color, and I get so many calls from people, patients, and patient family and nurses say, oh, so-and-so, I think need antibiotic because the color of the urine is different. And I say, well, if the person is demented, it could be that the person have an infection and the person cannot tell us, just like a little kid. They cannot tell us, look, I have an infection. So you will say, if the color is pus-like, and they say, yeah, there is an infection there. But the change in color of the urine is telling us that there could be damage to the tubular part of the kidney or the glomerular part of the kidney. The glomerular is the true filter. That's what all the blood that goes through your body, they have to go through this glomeruli to be filtered. Now, if you can imagine that the blood vessel that comes out from the heart is about the size of a fist. The kidneys are also about the size of the heart, each of them. It's about the size of a fist, and they are shaped like a bean shape. And imagine the heart the size of a fist. The main blood vessel called the aorta come from there. And then what the way God made our body is so that blood vessel give birth to smaller arteries. And those arteries give birth to small arteries. And we keep giving birth to smaller and smaller and smaller arteries. The smallest artery in your body are behind your eye, what we call the retina, and the same size of arteries are on your kidneys.
Really?
Yes. This is why a lot of people with diabetes, they first damage the kidneys and then they damage their vision. Because those blood vessels are so delicate. They are so tiny. That if you have diabetes, that is affecting the wall of the blood vessel. So by affecting the wall, you're going to shrink the lumen. By shrinking the lumen, you are affecting filtration. You cannot filtrate all the waste material that the body is producing. Then going back to our popular heart and our popular kidneys and our popular brain, well, if you have this waste material that's supposed to be coming out into the urine, staying back and being part of your daily life, well, guess what? It's going to affect your heart. It's going to affect your liver. It's going to affect your lungs. It's going to affect your memory. It's going to affect your mood. So you're going to act depressed, but you are not depressed. You're intoxicated. You have all this toxic material circulating through your body. So it amazes me that the media will not do justice to the noble kidneys.
The noble kidneys, you're right. And after you just described that, Dr. Mencia, they do so much work. That
a lot more than the heart. The heart is only a pump. You can put an artificial heart and you keep walking out there. It's a pump. You just have to create another pump to replace it. When you undergo heart surgery, they take the main blood vessel, they hook you up to a pump, and the heart stops working until they are finished. Then they hook you back up, and your heart go back to work.
Okay, well, let's go back to the first question. So people are listening now, and they want to make sure that their kidneys are functioning properly. Now, if
buy my book.
Oh, yeah.
Not only
Thank
buy
you.
my book. I have one of my patients that say, this is no information. What you guys do is so educational. And I'm always looking, what is it that he's going to sell? And you guys never selling anything. You know what? I'm selling this
Yeah,
book.
let's sell this
You
book.
know why I want
We're gonna
people to
sell
buy
this
this
book.
book? I want you to buy a ton of books and give it out to your family member.
What do they sell for now?
I cannot say because it's different price from Amazon.com. So I won't tell you
Yeah,
the
I know.
price, but
So-
you can buy in Amazon.com. The name is Take Care of Your Kidneys. That's KIDNEYS. So they can take care of you.
Yeah, it's a great
And-
book.
and
I'm
the
glad
au-
you're
the
doing that
author
today.
is Andy Mencia.
Yeah. How long ago did you write that?
Last year.
Last year. It's a fantastic book. As a matter of fact, I have looked at it and read it. I mean, I'm amazed. It's it's not very much. I think it maybe is 100 some odd pages. And boy,
And it
do
was
you...
written for the lay person, but even
Yeah.
professional doctor that have read the book, they
It's amazing.
compliment me on the
Yeah,
book. They
it's
say,
159 pages of gold. Actually, it's fantastic stuff. I'm so glad we're talking about this. So I want to keep talking
And
about the kidneys.
I love to educate. So
I know
the
you
book
do.
was written by an educator. So what I did, if I'm writing the book for my daughter to learn about the kidneys, I want her to learn about the genesis of the kidney, where the kidney came from, where are they located, what are they supposed to do, and then what can damage the kidney.
Perfect. And you brought up some very good points about people with diabetes, with the kidneys. But now
But
kidneys.
we spoke about the blood vessels, right?
Right.
How tiny they become. Not only diabetes. Imagine a person with high blood pressure and you don't even know it. That's why I get so angry when a person go to a doctor and the doctor tell you, I won't see you until next year. And if they are my patient, I say, no, me, you come to me frequently. Because blood pressure is considered the silent killer. The blood pressure is going to start going up and you won't even notice. Your blood pressure can be increasing right now. We are not even aware of that. But guess what? It's damaging your kidneys. So you should get checked frequently.
All right, now, how do you check someone? They come in for a physical. How are you going to check their kidneys? Just having a urine analysis?
We check we ask questions. First is the history of the patient. The patient say, from time to time my urine do change color. And sometimes it does look like Coca-Cola type of color. Usually that's indicative of bleeding. When the urine turns that color, either it could be bleeding from the bladder, that is the reservoir where the urine stored until you are ready to urinate, or it could be bleeding, which is worse, from the kidneys. And then we have to be more aggressive in treating that form of bleeding. The bleeding could be from an infection that can be easily treated and salvage the kidney. Could be from a cancer, where we have to be more aggressive in treating the kidneys.
Okay, so when someone comes in, but does a urine analysis tell you anything?
The urine analysis tells us a lot. When we do the urine analysis, is one of the things that we get from there is the specific gravity on the urine. The specific gravity is telling us how diluted or concentrated the urine is. Now remember, the kidney is supposed to be a filter. So if the urine is too diluted, too much water is coming out of the kidney, is not being reabsorbed by the tubules in the kidney. So the glomeruli is a filter. Then the tubule take everything that it wants back. So when the blood goes through the glomeruli, which is the filter of the kidney, and you have millions of glomeruli in those two fist-sized kidneys, when the blood go in there, the red blood cells, the cells are so big they cannot go through the filter. They are too big, they stay back. The proteins that we have in our body cannot go through the filter. They stay back. So they keep circulating, and only the junk, the salt and the junk, the nitrate, the urea, all of the waste material go out through the filter. Now, once they go, in order to get the salt, the unwanted salt to go out, you get other products like chlorine, magnesium, potassium that will also come out. But the way God made this organ is that, hey, I'm going to let you go out there so we can trick all the waste material to leave the body. But I need you guys to come right back in. And they come in through the tubular part of the kidney. Then the end product should be urine, which is just waste material and some water.
This is a strange question to ask you, but does your urine have a bad smell? Urine, will it change, the smell if it's diseased?
Yeah, the old timers, when, we used to live up in the mountains and stuff, and we didn't have doctors to come around. Do you know how people used to decide that you have diabetes? We used to take the urine and put it outside where there were ants. If the ants came in and started drinking from the urine, there's too much sugar in the urine. You have diabetes.
Oh my heavens! And talk about the witch doctor, right? That's the
well,
no, but you're right. I agree.
Yeah.
And that's how they could tell.
That's how they could tell. So if you urinate in the toilet bowl, and then you see ants coming to eat your urine, you know that you are a diabetic.
Yeah. Okay. But in our day and age now, does it? Urine does have
the urinalysis will give us the amount of glucose in the urine, in the blood test. So one of the things, the specific gravity, it gives us the amount of glucose in there. It tells us if you have red blood cells in the urine. Now remember, red blood cells are not supposed to be in the urine because they are big cells. They are not supposed to be spilled into the urine. So when you get a urinalysis and you see that you're having red blood cells, then you are in trouble. Now remember that protein are not supposed to go in the urine. They are big. They are big particles, proteins, so they are not supposed to be spilled into the urine. So one of the tests that we do is for albumin. It's a form of protein. So we look for microalbumin. We call it microalbuminuria. Urea because it's in the urine. So microalbumin, small protein, when you get that, that's when we have to start being proactive in preventing any form of damage. Because that's the first step you're going to have. And that's why every 3 months I'm checking a urinalysis on all my patients, regardless of their age.
Well, let's jump over to something else now. You said something about urinary tract infection.
Right.
Here's some more. I haven't used any of mine. You can have some more water.
Even if you use it, I take it.
Yeah, and also, but this is really important. So is it
954-491345.
Oh yeah. You're so. I know he's right. Everyone. Yeah, I get so involved.
No, but you can
in
get
this.
the book. You can get the book in Amazon.com also.
I know.
You can get it in
Amazon.com.
Amazon.com.
Okay,
But
I want
you
everyone
can
to
get it in
go
my
to the
office.
Adult and Geriatric Medical Center in Fort Lauderdale. And actually, if you want to go today, go, because even though they'll sneak you in, they have a busy schedule, but it's a Saturday, and Dr. Mencia does have Saturday hours. Of course, he has all the other days, too, but it's located at 1608 East Commercial Boulevard, which is just a little bit west of the Holy Cross Hospital. Medicare and most insurances are accepted. The phone number, again, is 954-489-1345. And actually, your website is really good now. I'm going to give that because people can get on there. Mm-hmm. It's called geriatrics.tv. Geriatrics.tv. And so I want to keep, and by the way, the next issue is coming out of Boomer Times, and you're going to be able to see another great article. Every month we do a fantastic article of, sometimes it's what we've had on the radio show, sometimes it's a little different. But I want to ask about urinary tract infections. Does that have something to do also with the, with the kidneys? Or is that different?
It could. It can be different. So let's say in a man with an enlarged prostate, and when he tried to empty his bladder, the bladder again is a reservoir. So while you're sleeping, while you are driving, while we are talking, the kidneys are producing urine. That urine cannot just come out. We will have an accident. We get wet. That's what we call incontinence. So the sphincter closes, and all the urine will stay in the reservoir until you are good and ready to pass urine. So a person with an enlarged prostate, when they go and urinate, they don't empty their bladder. And that ecstasy of urine is like when the water, instead of moving through a canal, they stop. It tends to get dirty when it stops. So when the urine does not come out when it's supposed to, that retention of urine make us prone to infection. And it also happens in women. A woman go and urinate, and that's why we do an ultrasound that we call pre and post voiding. So we have the person drink a lot of water, so they flush through the kidney, and then we see, let's say we got 200 cc of urine by ultrasound. Then we ask the lady or the man, now go and void, go and pass urine at the bathroom and come back to the ultrasound machine. They go, when they come back, if they still have from the 200, 125, they didn't empty their bladder. They think they emptied their bladder. So they are retaining, and then we'll try to work with the patient so that we can help the bladder empty better. Go to the root of the problem, which is my philosophy. Let's get to the root of the problem, find out why you're retaining, so we can treat that condition. You know why a lot of people retain, especially women? Over-medication.
Over-medication.
Don't tell anybody.
Over-medication. But wait, one more thing. And my gynecologist told me that a lot of us are in a rush. And we urinate, but we haven't completely urinated. And he explained to me that little extra left.
Blah, blah, blah.
Oh, you're so bad.
If the gynecologist say blah blah.
Oh my gosh! Okay.
No. With
so
all my love and
You're
respect,
so
but blah blah blah. No, when you urinate, if you are in a rush, believe me, if those pipes are working fine, look at those young kids. They go and they and out and off they go.
I'm not that fast.
Those young kids, if
Right.
all the pipes are working fine,
right.
you open the sphincter, urine comes out without forcing it, you close the sphincter, and off you go.
Okay.
So from time to time, even us, the boomers, can rush, go to the bathroom and rush and not completely empty from time to time, but not frequently. Once it's becoming a frequent problem, then we're going to get in trouble and we're going to get infection. How does it become a frequent problem? Because you might be taking medication that does not allow your bladder to contract and empty. So the bladder is like the milk in the breast of a cow. You have to pull it out so that milk comes.
That's over. You and your analogies are magnificent. Well, wait. Before we still have about four minutes or so.
Talking
I just want
about
to.
milk now. I'm
No.
thirsty.
I know. Okay. Well, let me just say then. But there are people who have bad kidneys. They can have transplant. They can have
Kidney
new
transplant.
kidneys, can't they?
Have,
Is that
yeah.
okay?
It's not okay. It's okay. The right thing to do is to avoid kidney damage. Believe me, it's not okay. When you go to a kidney transplant, you talk to anybody that will go for a transplant, you're getting someone else's kidney. That could be, close to a perfect match. The only perfect match is the one God have created.
Can you have only one kidney and survive?
You can survive on one kidney, absolutely. That's
Wow.
one of the organs that you can take the other kidney out, and the kidney left over will filtrate. You have 1 million filters in there. So it's very easy for the kidney to take over.
After this show, I love my kidneys. I didn't think about my kidneys before. I love my kidneys.
And you know what we should do out there, because we need to educate people. And I have right now one of my patients that read the book, and it's been translated into Italian.
Well, fabulous.
It's been translated into Italian. It's a doctor in Italy took the book that he translated books, and it's been translated into Italian. We want to translate in other languages. I think this is so important, not only for us here in the United States, but even more important for other countries, third world countries.
I love this. This was a great topic this morning. We don't have conversation at night at dinner table saying, "Well, how are your kidneys?" Or
And we, it's not like if you, there
I
are not
love
too
you
many
because
books.
you have such beautiful kidneys, right?
Uh-huh. I love your kidneys, Mama.
Show me your kidneys,
Show
honey.
me your kidneys, honey.
I got to give you the phone number.
Are those two kidneys all yours?
That's right. Okay, everybody, this is a phone number. Let's really be serious, because I tell you something. The one thing that shocked me is if you think you have lower back pain, it may not be lower back pain. It may be kidneys. Don't start taking medication when you don't really know that. Go to Dr.
Blindly.
Andy Mencia.
Yeah,
I mean, that is very important information, because it'll get much worse and could do very bad
Irreversible damage.
irreversible damage. Right. Thank you. Okay, call 954-489-1345. That's 954-489-1345. Go to the Adult and Geriatric Medical Center. It's over there, and you can just call them. And if you're having a real problem, just
And
call them.
for the members of Pencil Talk Radio,
Pencil Talk Radio.
take care of your kidneys,
Yes.
so that they can take care of you.
Go on Amazon. Buy the book. It's a great book. Love Your Kidneys. Oh. Yeah. I know. I'm interesting. I don't. You know what's funny? When you were talking about the kidneys, I really didn't even know where the kidneys are located. But now I know where they are, in the back.
A lot of people become anemic because they have kidney problems. The kidney also produces hormones. So it produces a hormone, the kidney themselves, called erythropoietin, and the erythropoietin goes to the bone and stimulate the bone to produce red blood cells. So guess what happens when you have kidney damage? You stop the production of this hormone, and you see a lot of people walking around with anemia and being very tired, and they go for blood transfusion, which is the old-fashioned treatment for kidney disease.
Wow, Dr. Mencia, you've done it again. It's always such a great pleasure. You're so good. Now he's going to run down to his office, at the institute to see your patients. I mean, he is just he's a magician. Thank you very much for being
You're
here with
welcome,
us.
and I love you so
I
much.
love you too, and our audience loves you, and we thank you.
And take care of your kidneys.
Yeah, take care of your kidneys. Love them. Wow, I gotta really talk to my husband about this. This is great. He doesn't even tell me what nice kidneys I have. I have to talk to him. We'll be right back. We have a wonderful guest, and I've been